These booster shots will be administered to healthcare workers who receive their initial dose during the first phase of Sisonke study between February and May this year. For more on this, I'm now joined by Professor Linda Gail-Bekker Director of the Desmond Tutu HIV Centre. Professor, very good evening. Thank you so much for joining us. So, what went wrong today? Why is the rollout delayed?
So we will be requiring the EVDS and an e-consent to be sure that individuals understand their rights as they participate in this trial. And that consent ran into a little bit of trouble yesterday during our beta testing. It just needed to be reworked somewhat. It's ready to go today, and healthcare workers should be getting their SMSs right as we speak, inviting them to participate in the consent process.
So you should be ready to go when? Tomorrow?
Tomorrow, around the country in many sites.
Okay. So, Professor, let's talk about this booster jab. This is the J&J booster jab, am I correct?
Correct.
What about, and we're starting this just with healthcare workers, and how important is it to right now start giving healthcare workers that booster jab, especially as we are expecting the fourth wave?
Yeah, so, as we look north and the countries that have been vaccinating for longer, the viewers will know that those countries are moving to boost their healthcare workers, as well as older people, as well as people with immune deficiency states. And the reason for that is there is some suggestion that the immunity invoked by the vaccine is waning, particularly in elderly people. Now, we've not really seen an impact on the effectiveness to avoid death or severe disease, but I think there is concern that there are indications that the immunity has reduced over time. And because our healthcare workers were offered vaccination very early, or the earliest in our program way back in February, we feel that it is important to increase their immunity with the view that we may be facing a surge of new infections. And so we want to protect those individuals as soon as possible.
So if the immunity is waning, we're talking about both J&J and Pfizer vaccines here, are we looking at taking booster shots periodically then? It's not a once-off?
I think that is how the picture's starting to look, although we don't know. So, again, as everyone knows, the story has unfolded as we have gone along. And, we know that in some cases, vaccines do need periodic boosts. Tetanus would be one example. Of course, the flu jab is the other example. But then there are other vaccinations, such as our childhood vaccinations, that we only need once, and that's good enough. So, I think we're going to have to see how this plays out. But certainly it does look like we may need to give everybody an additional shot within, 6 to 12 months of their first priming dose.
There were healthcare workers, it's reported, that they got the J&J, and then they went on and took the Pfizer vaccine as well. Will they also get the booster?
No, we don't see a reason for individuals to do that. If you like, they've already had their boost, and we really don't have any data to support a J&J followed by a Pfizer and then another J&J. So we really are advising those individuals to avoid this offer and to feel secure that they've already had their boost and are in good shape.
Professor, the focus on boosters now, will that not in any way jeopardize the, the vaccines? And I'm talking about the supply of vaccines here in any way, normal vaccines, because really that's where we should still keep our focus on, am I correct to say that?
I could not agree more. I think that is absolutely the focus of the national department, and rightly so. It's very important that we get at least one set of vaccines into individuals, whether it's 2 doses of Pfizer or a single dose of J&J, as soon as possible across the board. These doses have been donated over and above the national supply. So we are not removing any of the national supply of doses at this point. So I think that is also reassuring.
Okay, great stuff. Thank you so much, Professor Linda Gail-Bekker there for talking to us, Director of the Desmond Tutu HIV Centre.